Welcome to Tame the Taboo. This podcast is brought to you by Discover Her Health. Discover Her Health specializes in healthcare, education, and resources for her most intimate concerns. I'm your host, Nurse Jenna. I'm a women's health and gender-related nurse practitioner, and I am making it my business to take you from sufferer to sensei. So if you are suffering from conditions that are not easily treated in an annual exam, or you want to join me on this journey to become my healthiest, wealthiest, best business owning self, sit back, relax, and enjoy these episodes. All right. Welcome back to another episode of the Tame the Taboo podcast. I'm your host, Nurse Jenna, and I'm so excited today. We have another nurse joining our ranks, Miss Amy Felix. So welcome to the Tame the Taboo podcast, Amy. I'm so excited to have you here.
Thank you so much for having me, Jenna, and hello to everyone out there.
Yay. So, Amy, I am excited to bring you on the podcast because we're talking about, money and health and all the things that are taboo. And one of the things that is really taboo, especially when it comes to healers, nurses, is taking a break, just the idea of rest. And you have really started to champion this idea amongst nurses with the nurse sabbatical. So tell me what it is and how you are championing rest.
Absolutely. So I'm so glad that you mentioned the idea of the fact that we are our worst caretakers, us nurses. We always tell our patients, take care of yourself, make sure you drink lots of fluids, eat 3 meals a day, eat healthy. And we're the ones who are not taking bathroom breaks, not taking lunch breaks, and vacation. What? How many vacation days? So really and truly, having come from a leadership role most recently in nursing, I really looked at myself as well as my colleagues and my team that I was working with and really saw that we weren't taking breaks. We were just doing the most that we can for our patients as well as for our hospital, and found this idea that if we took breaks, maybe we would be in a better place. Maybe we would not be as burned out. Maybe we would still have joy in our work. Maybe we would still be enthusiastic about the work we can do in the future. And so kind of developed this idea of like, well, let me champion it by first taking a break, which is why I founded the Nurse Sabbatical, this idea that nurses can take career breaks and chase dreams. And it doesn't necessarily mean that you just stop working completely, but you just lessen your burden and your stress so that you can rejuvenate your spirit and do the things that you love.
Mm. It's so, we've talked before and been able to connect, and it is so refreshing to hear you be the champion of this because not only are you a nurse, but you're also a Black woman. And I feel like those two identities of like being a Black woman and being a nurse, like the odds are against you for sitting down and taking a break.
Yep. Definitely. I think that sometimes, especially as Black women, we carry this burden that we have to be the best. We have to work twice as hard. I mean, I grew up hearing those sentiments in my mind from my family as a first generation immigrant on top of that. And so it was kind of do more, be the best, no matter what, never see you sweat or struggle. And yet the reality is that we're all human. We're all human. And if we don't take time to take care of ourselves, how can we take care of others, especially as Black women when we know the burden is so much on our shoulders?
Mm-hmm. So tell me, what did your break look like? Like, what did you do? How did you announce it? How did you come up with the idea of doing it?
Sure. I think I was getting to the point of my job where, I love being a nurse and will forever love being a nurse, but I realized that I didn't love what I was doing anymore. And that's a hard place to be in, especially if you've given so much to your career. You work hard, you get your degrees, your masters, your certifications, and then you sit back one day and say, but I don't love it anymore. What does that mean? And for me, it meant, well, I need to take some time to figure out what to do about that. Like, I'm not just going to up and quit. But as time went along and I played around with this idea, I was like, well, what if I could just take just a few weeks off or even a month off just to relax, take a nap in the day, watch Netflix, like not be on call? It would be beautiful. But being in leadership at that time, I knew that none of my colleagues were thinking that, and I had to figure out a term for it. Hence the reason why I thought of the sabbatical, because we hear physicians take sabbaticals, priests take sabbaticals, professors take sabbaticals, doctors take sabbaticals. What about nurses? We don't get career breaks. Sometimes we don't even get enough vacation break. So when I looked at
bathroom breaks,
that too. And so when I sat and looked at it, I said, you know what? I can plan to take 3 months off and do nothing. The first 2 months, I'm going to travel, I'm going to relax, I'm going to eat really good food, and I'm just going to enjoy the moment without a plan, without an alarm clock. And that's what I did. I literally would wake up in the morning, I'd work out, one of the things that I talk about is I drink tea out of a mug in the morning and enjoy it versus like, let me throw it in the cup, the coffee, run to the door, get into my car. Like I got to enjoy the moments of everyday life. And I forgot about how precious those moments were. And even while I was on break, it wasn't that I stopped doing everything completely. I was focusing on nurse well-being because I realized I was passionate about it. So I was doing a little consulting work, maybe an hour or two a week. So my mind was still there, but overall, I was in a very relaxed state. And so I did that for about 2 to 3 months until I was like, all right, maybe I should start looking for a job, or that's what my bank account says. And, that's absolutely fine. But as I got to the 3 month mark, again, I still wasn't feeling any joy from anything that I had seen, and kind of decided to delve into this entrepreneurship role where I got to figure out what's the next steps and how can I really make an impact in nursing while not working as the way that I used to.
So for me, I took a step away from the traditional 9 to 5 to start
Mm-hmm.
my practice, Discover Health. And it's like I traded working 9 to 5 to now just working 24/7. So that journey into entrepreneurship can really, really be a lot. So what sort of advice do you have for like young founders who are just getting on their path, who, don't want to be busy all the time?
Right. I think you speak to that so much. As I was talking to someone, I said, "Oh, I'm an entrepreneur and I was burned out in my nursing role." And they're like, "Do you not know the percentage rates of burnout in entrepreneurship?" And I was like, "Facts." But I think that it really is understanding yourself, right? It's really taking time to take a step back and understand your why. Why is it I'm pursuing entrepreneurship? Why am I doing this? Is it for me? Is it for my family? The benefits of time, flexibility? Why am I doing this? It's very easy to say we're chasing it for money or dollar, but there has to be another intrinsic value. And then I really talk about the idea of, well, what do you want your life to look like? Is it that you want to work all of these hours? And if it isn't, then how do you build a business that allows you to flow into the work that you do and do it with ease? And that's truly how I work now. Sometimes my days don't start till 10 a.m. I know I have a ton of things to do, but I make sure that the time that I have available, I focus really hard on the things I have to get done, and I don't stress on the things that I don't get done. And every day I go in with the same practice, but I know that, walking outside is important to me every day. Sitting down to have lunch without a computer or a phone in front of me is very important for me every day. I make sure that I sleep 6 to 7 hours, which sometimes is not realistic for everyone, but that's very important for me. So I think as you build your business, you have to identify your why. You have to identify what you want your life to look like, and then start making steps every single day to get to that point.
I love this idea of building your business around the way that you want your life to look.
Hmm.
So that's a really beautiful thing. And that's something that I'm trying to do and really set boundaries and say, I'm only going to see clients between like these hours. And what it's allowed for me is actually to be more creative, because when I have time to like tap in with myself, then I feel like I'm just more connected to source, universe, God, whatever it is. And I feel like I can hear the message just so much more clearly when I am rested and rejuvenated. And that just fuels my creativity. Have you found that too?
Absolutely. As you see me nodding my head here, absolutely. I said, the part of me that I discovered during my sabbatical is that I am a creative. I'm an innovator. I love to innovate and try different things. And when I don't get that space and block of time to do that, then I'm just on a hamster wheel, right? And so it's truly making sure that you have that time to do that. There's a book that's called Cal Newport, and they talk about by Cal Newport, and it's talking about this deep block of work. Like you schedule time in your day to do that deep thinking, that uninterrupted, where you can just create and let your mind flow. And I make sure I try to carve that out at least 3 to 4 times a week in
Mm-hmm.
order for me to have that creativity. So then I can do all the busy work. Because if you can't create, then how do you expect the busy work to just help influence your business? It's really challenging.
How important has building a team been in your journey in entrepreneurship so far?
I think it's very important, but I will also be honest and say it's very hard. The entrepreneurial journey can be a very lonely one. Yes, there are tons of people who are out there saying they're entrepreneurs, but it is hard to find people, especially in the nursing world, who are in like-minded space, starting businesses and to build. But I think there are two components. It's building a team, meaning finding the right people to support you so that you can do your best work, whether it delegate out or just support the vision of your company. And then twofold, it's building community, the people that you meet, like how I met you, right?
Mhm.
The people that you meet that kind of support you and say, hey, I can help you here and I can help you there. And, but you can support me here. And as you grow in your business, both of them are so important to have. This idea of a team to support you so you can do your best work, and then a community to also help support you.
Definitely. And I'm so happy to be a part of your community and to have you a part of mine because,
Yep.
as you said, it can be very lonely. And it's just nice to know that I'm not the only, like, innovative nurse out here
Yep.
trying to do something different. And we have a lot of common. We're both Penn grads too. And I
Yep.
think that's actually how we got the connection is through a mutual mentor. So I think
Hmm.
once you start asking for community, asking for help, then it's like, okay, the universe, God, it's like, okay, she's ready for it, you know?
Yep.
And so I was really at that point when we first started to connect of like, I need to meet people who look like me, who have values like I do, who are in the grind so I don't feel so alone. And here you are. So,
Yep. And it becomes almost serendipitous, right? You meet people and you're like, it's not even just what can you do for me? It just helps re-inspire me. Like even hearing your story and your journey, it's like, I am not the only one who wants to do it differently. Because it's very easily to say, okay, I'm gonna get a bachelor's, and I'll get a master's and maybe a DMP, and I'll just keep going on this trajectory. But if it doesn't resonate with the things that bring you joy, then you're just following a path that may not be for you. And it is okay to veer in a different lane.
hmm definitely. And if you're not enjoying the path, right? Like if you're not enjoying the
Yeah.
voyage, it's like, this is it. The work is the work. It's what you're supposed to be doing and also
Yep.
enjoying it. And if you're just waiting on the end goal to find your peace, to find your joy, you'll never find it.
You won't.
Hmm.
And I think that definitely takes time. And, that's things that I talk about with the whole sabbatical work is like taking that time to find it. Like, yeah, you might be on the path and you're enjoying it. And then one day you're like, wait a minute, is this really what I want to be doing? But that's okay. People don't talk about, how they've all pivoted or taken a step back. You and I had that conversation. But as I've met more nurses, many of them said, oh, yeah, I actually did take a month off to figure out what I want to do. Or I took a step back or ended up working part time so I could have more time for my family and for me. And we don't hear those conversations. Sometimes in the hospital world, when we hear people are dropping their status or changing, they're like, well, what's wrong with them? Why can't they just do it? We're all doing it. It's not meant to be the same for everybody.
Mm-hmm. And this idea for me came of starting my business was planted when I was in undergrad, but really when I was on maternity leave, when I had time to just be
Hmm.
still and have an identity outside of nurse. It was like, no, you really got to do this, right? Like you
Yeah.
really, it's now or never. And so I love this idea of having a maternity leave without having a little one to take care of too, just like taking 3 months to baby yourself, to care for your dreams, to nurture your wishes, your wants. So it's really a beautiful thing that you have going.
Thank you. I know it was very interesting. I was talking to someone where I used to work, and they had called me a year later, and they're like, well, where have you been? What are you doing? And I described to them what I was doing. And she said, wow, because the only time I've taken a break from work is when I had my children. And she's like, other than that, I never took time away. And I was like, she was like, wow, I should have, right? And we kind of look hindsight in life and say, oh, I wish I could do different things in various paths. But I think there's something really novel about the idea of taking time to nurture yourself. And like I said, that could be weeks, it could be a few months. Some people really are able to extend it for a year, and kudos to them. But there's something truly amazing about that experience.
hmm And I think even if you aren't ready to like make the jump into entrepreneurship, you can still do some of the small things. Like you said, turning off your computer when you're eating lunch. I need to practice that. You motivated me today because I'm constantly like trying to multitask and it never works. I'm dropping the ball here, dropping the ball there, not eating or,
Yeah.
So that's something that I'm going to try to be mindful about is let me just turn off electronics when I'm trying to feed myself and have time
Hmm.
with myself. Like I really
Yeah.
do miss the time when it's just me. I like myself. So definitely incorporating those small steps could be really good.
Right. And I think sometimes we think it always has to be these grand gestures, and it doesn't have to be. I mean, even working in the hospital and leadership, there were times that I would schedule a lunch break so no one would put anything on my calendar, and I would take 10 minutes and walk outside. Even when it was cold, it just broke up the monotony of the day. It gave me a fresh perspective to come back in the afternoon and do the work. And I talk a lot about these tidbits of little things we can do in our day that could just change the entire nature, the stress level, the intensity, our well-being, and help prevent burnout. So yeah, definitely try eating without a computer.
So right now, you're still doing a little bit of direct patient care, but most of your clients are other nurses and kind of coaching them through their sabbatical. Is that correct?
Correct. So I coach nurses through sabbatical. I even help coach nurses who are trying to figure out, do I want to start a business, or what is the next step in my career? I've been doing this for 10 years. I want something different. I don't know what that looks like. So I do coaching on both ends, as well as I do consulting for hospitals about how to develop nurse well-being programs.
So dope.
Yes.
So if someone is listening and they want to work with you, like what does it look like to work with you?
So really, it's an individual approach. It's all about you. It's not centered that this is the only way to do a sabbatical and you have to do it my way. It's really this whole idea of like, what do you want your life to look like? Let's pause and reflect on that. What are the things that would bring you the most joy you think in this moment? And then how do we develop this idea or plan to get you to where you want to be? And it really is that simple. And you might say, wow, I could probably do that on my own. But it takes a lot of mindset work. It takes a lot of accountability because it's very easy to kind of slip back into, this is all I know. I need to do it this way. And this is the only way I can do it. And so I really support my clients in figuring out what will work best for you, your husband, your wife, your kids, what you're trying to do in your life, and not just say this is the only way to do it. So it's very one-on-one, molded by what they want to achieve and then helping them achieve it.
Okay. All right. And so, okay, I am interested. I'm going to find you on Instagram, right? So it's
Yep.
at the Nurse Sabbatical.
At thenursesabbatical.com or my website, which has all of my contact information, as well as opportunities to schedule bookings with me, which is www.thenursesabbatical.com. And then I'm always on LinkedIn, just kind of giving tidbits on how to be well. And Amy Felix on LinkedIn is where you can find me.
Okay, so now we're connected. I'm like very interested in working with you. I reach out, we schedule our meeting. What else besides the one-on-one? Like, is there some sort of community of other like-minded individuals?
Yes. So I do have a Facebook group, and then we have a way of communicating together. You'll be in touch with my newsletters, and we will connect and help you that not only through the one-on-one coaching, but maybe you're before that. Maybe you're just contemplating it. How do we keep you involved with a group of like-minded nurse practitioners who, well, not even nurse practitioners, but nurses in general, because it's kind of all throughout the career spectrum. How do we get those people connected? So I do have a community where people can kind of talk and have conversation about what to do next.
I love it.
Yes.
Okay, so we're working together. What does success look like? Because taking a break could be so different for so many people, as you've already described. So, like, how would someone reflect back on our relationship or their relationship with you and be like, that was successful?
I think they have to define, and which is what we do initially, is what they want success to look like for them, right? So if you tell me, oh, well, at the end of it, I want to take a break and I'll be a millionaire, that's an unrealistic success, right, Mark? But normally, in terms of my coaching, which starts at 3 months, it's this idea of like, what is that one thing that you want to achieve that will kind of shift the perspective? Maybe for some people, it is just planning a sabbatical. So that's one part that we do. Maybe it's figuring out what are their career options. And maybe they don't want to take a full break, but they want to take some time to figure out how to get to the next step that will bring them ultimate joy. So then we talk about that's the success goal. These are the things that we have to do in order to get there. So really, it is based on the person and what they're trying to achieve. My goal, and has always been for all of my life as a nurse, is to really help people. I want to help other nurses discover what I've discovered in my career. So.
And did you set out on your sabbatical, or I guess how early into you taking a break did you decide, I want this for other people too?
Honestly, it probably was a little bit 3 months, 4 months where I was like, This is more than just me sharing my story because I felt like I was the only one out there who ever done anything like this. And I found other people reaching out to me, not only in nursing, but in organizations that had sabbatical programs. And they say, can I just talk to you? Like, what does it mean when I take a break? And I'm like, but you're getting a paid one. Like, that should be an automatic yes, right? And as I had these conversations and the conversations continued, I was like, well, how can I support other nurses doing this? Or even seeing this as a possibility or a potential. And that's how I started brainstorming of, what is it that I like to do? I love motivating people. I love seeing people achieve their goals. And how do I align that with my passion? So hence you get the nurse sabbatical coaching.
I love that. And I think as nurses, we are who we are. We're helpers no
Hmm.
matter what phase of life we're in. And the same for me in starting my business. As I was starting my practice, I was like, I'm learning so much that no one had ever thought to teach me as far as like business and
Yep.
development and all these other things that you need to be a nurse entrepreneur. And a couple months into me doing this, I was like, okay, I'm going to document everything so that I can
Yep.
help the next person along. And so it really is just so special because as nurses, that's at our core what we want to do is we want to help, we want to heal. And so it's like not just for me, but also for the
Right.
girlies behind me.
Exactly. And I think you speak to the idea of where's your level of expertise or your unique skill value. All of us as nurses, we have so much critical thinking, emotional intelligence, but we also have something uniquely that's passionate about us. Like I could probably never do what you do because I like working with kids. I like working with nurses, right? And other nurses may be like, well, I want to help someone in geriatrics or I want to do IV infusion. Like we all have a special gift. And it's really discovering that gift and letting it shine with the skills and knowledge that we've learned in nursing school. And when you combine both together, it's just a beautiful thing to see develop.
Especially if you have that creativity, if you've taken that break, if you've been able to refuel, then it's like, okay, now it's gangbusters.
E-
Now,
exactly.
now we just got to let it flow. Now we get to be in our flow.
Flow. Yes.
I love that. Okay, so what else do you have or other pieces of advice that you would like to share with the audience today?
I think I highlighted many of them, but I honestly want to say to the audience today, like, it is your time. Don't feel like you have to wait for tomorrow, next year, wait for the New Year's resolution or for some magical thing to happen. Your time can be any time. So if you feel this gnawing inside of you that tells you something has to change, something needs to be different, explore it. Find people like myself. There's so many coaches out there. Find someone that resonates with you, that you feel like, wow, they probably get what I'm going through. Reach out with them. It's your time. It's your time to make that next step in your life.
Hmm. Take the break. Get ready
Yep.
for launch.
Yes, exactly.
I love it. Well, it has been such a pleasure talking to you. And I just want to thank you for helping us to tame the taboo today, Amy.
Thank you so much for having me. And I am so glad I was here.
Yay! Thank you for tuning in to this episode of Tame the Taboo. If you enjoyed it, don't forget to hit like, share, and subscribe. Send this to your girlfriend so they can join you on your journey as we transition to our healthiest, wealthiest, best selves. See you in the next episode.